Welcome all of you. My name is Dr. Mohammad Fiaz from University of Education, Dijikha campus. Today we will discuss about human loss that we encounter occasionally. Throughout time, lice, particularly head lice, have been a common reoccurring problem, especially in schools. Millions of school children may encounter head lice during the school year. Before World War II, head lice were fairly common in the world. Body and crab lice much less so. After World War II and the emergence of DDT as a house control agent, outbreaks of lice were much less common. Now, lice again are intruding into the environment of the average people. Lice or their eggs are easily transmitted from person to person on shared hats, coats, scarves, combs, brushes, towels, bedding, and seats in public places, and by personal contact as well. Sharing these articles is common among young school age children. As a result, head lice infestations are most prevalent among children, whereas body and pubic lice are more frequently encountered among young adults and middle aged persons. When someone becomes infested with lice, it is likely that entire family will become infested. Human lice infestation, called pediculosis, can spread rapidly and may reach epidemic proportions if left unchecked. In a group of people, such factors as age, race, gender, crowding at home, family size, and method of closeting clothes influence the course and distribution of the disease. The length of the hair does not appear to be a significant factor. There are three types of lice who infest humans: the body louse, head louse, and crab louse. Head lice and body lice are morphologically indistinguishable, although head lice are smaller than body lice. Head lice and pubic lice are highly depending upon human body, its warmth, and will die if separated from their host for 24 hours. Body lice are hardier since they live on clothing and can survive if separated from human contact for up to a week without feeding. Lice have simple or gradual metamorphosis. The immatures and adults look similar except for size. Lice do not have wings or powerful jumping legs, so they move about by clinging to hairs with their claw like legs. Head lice prefer to live on the hair of the head, although they have been known to wander to other parts of the body as well. Head lice do not normally live within rugs, carpet, or school buses. Body lice live in the seams of clothing, generally where it touches the skin, and only contact the body to feed, usually holding onto the clothing while they do this phenomenon. However, sometimes they will move to the body itself. The eggs of the lice are called nits. They are uh, oval white cylinders about 1.16 inch long. The eggs of head lice are usually glued to hairs of the head near the scalp. The favorite areas for females to glue their eggs are near the ears and back of the head. The eggs of the body lice are laid on clothing fibers and occasionally on the human body hairs. Under normal conditions, the egg will hatch in 7 to 11 days. The young lice which escape from the egg must feed within the 24 hours or they will die. Newly hatched lice will periodically take blood meals and molt 3 times before becoming sexually mature adults. Normally, a young louse will mature in 10 to 20 days to an adult. Adult Adults range in color from white to brown to dark gray. The body louse is the vector of three human diseases: epidemic or louse-borne typhus caused by Rickettsia prowazekii, and trench fever, which is caused by Rockelemia quintana, and louse-borne relapsing fever caused by Borrelia recurrentis. These diseases are not presently being reported from the world, but their introduction at some future time is not impossible if body louse infestations should become sufficiently prevalent. Although head lice have been experimentally infected with rickettsia, neither head lice nor pubic lice have been implicated directly in active disease transmission. Although body lice may pose the most serious health threats in many countries, head lice appear to be the greatest nuisance, particularly among school children in highly developed countries where their presence is considered intolerable. Adequate, uh, Adequate sanitation, including frequent changes of clothing and laundering clothing and bedding in hot water, or dry cleaning, ordinarily is enough to prevent permanent infestation of the body lice. Since they remain on the clothing and are killed by the cleaning process. However, head lice and crab lice cannot be controlled in this way. Once a few lice are picked up, they remain in the hair and are not killed by ordinary shampoos or bathing. Insecticides are therefore necessary to control these species and to control body lice. Chemicals are available as prescription or non-prescription drugs to control lice. Over the counter uh, products which should be effective include those containing permethrin or pyrethrins as active ingredients. These drugs are available as creams, lotions, or shampoos. Shampoos are preferred for control of head lice. The application of these insecticidal drugs will kill nymph, adult, and some eggs as well. Eggs killed by treatment as well as unaffected eggs may remain attached to hair shafts and should be removed as soon as possible. To remove these eggs, it may be necessary to do some nitpicking utilizing a special fine tooth lice comb. Combs and other tools used to remove lice should be soaked in a lice killing solution, such as rubbing alcohol after use. Use of lice sprays to treat objects such as toys, furniture, carpet, etc. is not recommended because lice cannot live off the host longer than a couple of days. Insecticidal shampoos are available as over the counter preparations at drugstores. Carefully read the label as some shampoos should be used only once. Prescription products containing the active ingredients malathion and lingain are not recommended for use on children and adults. These products have had reported side effects. In addition, never use gasoline or kerosene or other flammable liquids as home remedies. Children have been killed or severely burned as a result of accidents that occurred while using these flammable liquids. Knitcombs with much smaller spaces between the tines are also commercially available for regular use in the control of head lice. So, this was all about human lice. Hope to see you in the next lecture. Take care.